This is Dr. Robert S. Brown at Fort Lee, Virginia. I'm going to talk to you about a topic today that's on the sad side, but sometimes it's very appropriate to be sad. I want to talk to you about grief. Grief is a normal reaction to a loss of any kind. It could be a loss of your rank because of some misconduct. It could be a loss of a relationship. It could be the loss of someone you cared about who died. But any loss is going to be followed by a normal feeling of grief. There's no time period that we can put on grief and saying, well, it's going to last 2 weeks or 2 years. There's sort of a reasonable period where people who are grieving over someone that's been taken away, someone has said that's like getting over a major surgery. You can sit up on the side of the bed right after the surgery. You might even take a few steps. But you don't really heal up from surgery, major surgery, for probably about a year. The normal expectation then is for you to get back into your usual lifestyle after you've had a loss within about a year's time. But let me say some things that are puzzling to people who are in grief that you might not understand, and it's important to have an awareness of this. It's not uncommon, acutely after losing someone you cared about, to have the feeling you're seeing that person around you. It may be an illusion. You may walk up behind somebody and think right away, gee, this is the person that I know that was killed. And then you see, well, it's really somebody else. But the idea is not to be frightened by this, or to pay too much attention to, quote, visitations from the deceased, because this is not really normal. It may be normal for grieving soldiers who have PTSD, and it may be a good sign that there's a visitation from someone who has been killed. And you may see them around, because this is telling you that there's some unfinished business, that you've got to go back and visit this loss and to deal with it more openly and learn how to say goodbye to this person so you can remember them with less pain. Let's review what has been called attachment theory. It takes a long time to develop a relationship with someone that you care about. This is called attachment. We see it easiest in children. As they begin to grow up, they become attached to their parents and to their friends and to the family and to the school. Attachments are very important. And the style of attachment in early childhood seems to have some influence on attachments later in life. For example, secure attachments in childhood predict a very secure future in relationships that you may have with others as you grow up. There's also insecure attachments, such as anxious ambivalent attachments or avoidant attachment styles, where people tend to stay away from other people and don't really have the capacity to develop strong attachments. The United States Army is built very strongly on attachment theory. They don't call it that, but all of your training has taught you how to rely on someone next to you, that you're walking in the footsteps of people in front of you, and people behind you are watching you, and people on either side of you have your back. These are the strongest kinds of attachments. To have a person like that taken away by enemy fire, IED, blast, or rocket-propelled grenades, whatever the source of that trauma, it's going to have a lasting effect on you. And the worst thing you can do is to make believe that nothing important has happened. Try not to avoid thoughts of that person. You may dream about that person. You certainly may dream, even in the form of nightmares, about how that person was killed. But you've got to learn to accept the loss and to move on with your life, but this will take time. There are many different ways that you can do this. One is to write a letter to that person who's deceased. You don't have to mail it, but you can talk about your feelings of that person, what that person meant to you, and you can keep that letter and take it out once in a while and read it. Or you can keep a journal of your thoughts about your memories of this person. You may tend to focus on the last few moments of that person's life, but you usually knew that person for many months, if not years. And the idea is to remember them in their entire lifespan that you were aware of, and not just to think about the last few moments. The services that we have for lost soldiers, such as memorial services and the blowing of taps and the firing of the 21-gun salute, all of these are the military's attempts for you to say goodbye to the person you have lost. But you know that when those memorial services are over, when you're all alone, you got to find a way of saying goodbye to that person, and you do it by remembering that person in as much detail as possible. How do you do that, you may ask? Well, one of the best ways is to talk to friends about that person who knew that person also. Also ask yourself, what impact has that person's death had upon me? And don't stay with that question, but quickly say, what impact has that person's life had upon me? How am I different as a result of knowing and living with that person and having a relationship that was life-saving for me and for others with that person? If you really want to get through grief in the most healthy way, remember the good things about that person. No one is perfect. You can remember their faults as well as their strengths. That's perfectly all right. One of the things that keeps soldiers from grieving is an irrational sense of guilt. Soldiers often blame themselves for the loss of someone in combat when there was nothing in their power they could have done to prevent the death. Make sure that you're not carrying around a sense of grief that is irrational. Take responsibility for any mistakes you made and discuss those with people you trust. But don't walk around with a sense of grief that's all confused by guilt. Grief and guilt interfere with each other. If there's a lot of guilt, try to get rid of that first, and don't expect to grieve normally until you've gotten that guilt under control. Another thing that interferes with grief is anger. It's perfectly normal to be angry over the death, which often seems useless in combat, over the death of a close combat battle buddy. But don't let that anger interfere with your grief. Let that anger run its course and express it verbally in some meaningful way, again with someone you trust. We found that in group therapy it's very important to talk about the loss and to try to deal with it in the most rational way possible. The defining characteristic of a human being is rational thinking. In the same way that the rational characteristic of a fish is aquatic life, and the rational definition or the defining definition of a character of a bird is flight, what really defines us as human beings is our capacity to think. We want to get you thinking straight about the loss. There's perhaps nothing more painful than the pain of grief over the loss of someone you really cared about. Don't try to drink it away. Don't try to guilt it away. Don't try to rage it away. Try to deal with it verbally and find the words that will express that feeling again to someone you trust. As a quick review then, grief is normal. It has a lifespan that may be at least a year and sometimes longer for others. People grieve in different ways. People who are religious often involve their beliefs about their most important people in their theological framework. Atheists grieve in a different way. People, even who are Christians, among each other will grieve in different ways. The important thing is to do the work of grief. It's painful. Don't put it off. Sometimes grief can be delayed for years and years, and that will interfere with your physical and mental health. Sometimes we try to keep people alive by keeping things that belong to them and keeping them in a special place, and going back and picking them up and touching them and thinking about that person. That's all right up to a point. But if that becomes an interference between you and the loss of that person you cared about, don't hold on to those things and treat them that way. In psychiatry, we call those linking objects. Linking objects serve as substitutes for the person who died. But you have to face the fact that they're only substitutes. They're not really the person. If it's possible, visit that person's grave and say goodbye to them at the grave. Visit their family. There's nothing more valuable to a family member than to have someone who knew the loved one who was killed, who can tell that family what this person was like, especially as you knew them. They will remember your words for the rest of their lives. Don't keep that valuable information hidden away someplace in your life. Share it with them. Be courageous and grieve openly and tearfully, ideally. Soldiers don't like to cry, but find a way that you can cry, perhaps in some place that's private. But let grief run its course. Don't block it up. Don't let it become something that damages your own life. You will always have a relationship with that person who has died, but it will be different. It's not going to be the end of the relationship. It's going to be the change in the relationship. And for those who have faith, you can hold the belief and hope that someday you will see that person again. But the bottom line is to grieve. Do the work of grieving. And do it with someone who has special training if you need it, and who can teach you how to grieve. Grieving is not going to make you a hero. It's not going to make you mentally ill, but not grieving could make you mentally or physically sick. So be courageous. Pay a tribute to the person's life that was lost. Don't let that person be forgotten. Hold them in reasonable, prudent respect. And I think you'll begin to feel much better.